Hey, it's Angry Bill. Let me talk to you about how to confuse a customer, how to make them make the wrong choice, and how to undermine yourself. A couple of weeks ago, I went to a tire shop to get a little puncture fixed. You know, you pick up some road stuff and they'll fix it for you. So I was in there waiting for my tire to get fixed, and a lady was shopping for tires for her Mercedes. Apparently, her Mercedes uses 225 40 17s
on the front and 225 40 17s on the rear, but they can upgrade it to 18-inch wheels. And does she know about speed rated and all season versus
It was out of control, the details that this tire shop salesman was getting into. I don't even remember all the stuff. All I know is I vegged out, and looking at her, you could see a glassy look on her face as she just wanted to escape. This guy was going on for about 15 minutes about different price points and different options and trading in wheels and rims and just making a mess out of things. I felt bad for her because I vegged out and quit listening, and I know that she did too. I bet she went to another shop and got someone competent to help her. Often what people are looking for from experts is to make a choice for them. Narrow down their options to some correct options and go from there. What's the best choice? In that tire shop, the salesman offered her too many choices based on technical information that she didn't understand. There's no way for her to be able to synthesize all the risks and benefits and costs and options and speed ratings and all season and everything else that goes into it. She isn't a tire salesman. That's not her expertise. I'm a paramedic, not a tire salesman. If a jacked up car falls on someone, I'll have opinions as to what needs done. Until then, I'm not a tire salesman. I'm not the expert in that. The last time I had to buy tires, the salesman asked me what kind of tires I wanted, and I said black ones. The salesman should have learned what the customer needed, how she drove her car, what kind of car it was, that kind of thing. Narrowed it down to a choice or two that were the customer's best options. I almost said the patient's best options because that's how similar it is to what we have going on in EMS. We need to inform people of technical information all the time. Technical, medical, scientific information is a part of our job. It's not what most people's expertise is. Most of our patients aren't medical providers. And even when they are, they want to talk to me about how they were an EMT back in Vietnam or something. That's not what I'm talking about. I'm talking about up-to-date options, up-to-date choices based on up-to-date science. So it's difficult for a non-expert to accurately weigh the risks and benefits, giving choices multiplied by the relative odds and conditions such and such and all the rest of it. People get confused. So let me tell you how I handle it. If it were me. That's the phrase I use, if it were me. Other options are if you were my mother or if you were my kid or if you were my family member or whatever, but if it were me, and then I give them good information if it were me. Now granted, if what I would usually do involves like drinking whiskey until I fall asleep and forget about it, then maybe don't give that piece of advice or whatever. But if it were me, I'd go to the hospital and get stitches. If it were me, I'd go to urgent care. If it were me, I'd take some Tylenol and rest up. If it were me, I would make sure to give people technical information in a way that they can understand it, narrow down their options into reasonable ones, and help steer them into the right choices. I even have some common sayings that I say all the time. So for example, with car crashes that I think have low risk of injury or no injury or stuff like that, this is what I say. If it were me, I'd go home and take some ibuprofen and rest up. It's pretty common to be sore after a jolt like that. And soreness responds to ibuprofen or Tylenol and rest and maybe some ice or something like that. But I need you to understand there's a difference between soreness and pain. Soreness gets treated by being mellow. Pain needs evaluated by a doctor. So I need to get you into the ER. You need to give us a call back if pain develops. Does that make sense to you? How's that sound? If it were me, I'd send him to the hospital in the ambulance. It could be something simple like a minor breath holding spell, but at his age, he can't talk to us to tell us what's going on. It could be something more severe, and I'd feel a lot better if I could keep an eye on him the whole way to the hospital. How's that sound? Give people your honest opinion. You're the expert. You have to make people aware of the higher risk, more dangerous stuff that could potentially be going on, but they also deserve to know that that's unlikely. There's a difference between unlikely and no chance, but given what I'm seeing, the best option is whatever, if it were me. Don't try to sell patients on too much tire or too many tire options. Don't be like that tire salesman. Tell people what they should do, and if you don't know something, tell them you don't know. If it's risky, tell them it's risky. People still make choices that are either for or against my opinion all the time. They're still in control. This is still a collaborative medical decision making. But I do it in a way so that way they're not confused. I can deliver the information that's important for them to make their decision on without confusing them with too much information. If it were me, I'd like, subscribe, and share, especially the subscribe part. Until next time, this is Angry Bill. Quit confusing people.